Welcome. Thanks for joining us. Well, we're going to talk about mental acuity today. How's your mental sharpness? Are you able to remember things? Are you able to do those crossword puzzles? Well, they say that crossword puzzles is the answer if we want to increase our memory. But today we have Dr. Peter Fatinos with us with Revita Medical. How are you?
Doing well. How are you doing, Francine?
Mental acuity, I'm fine. I wish I was better.
Yeah.
But they say after a certain age, you're going to lose this mental sharpness. Is that true?
Yes. And that's going to be over time. Some people lose it faster than others. With what I do with hormone replacement, a lot of it is linked to the loss of hormones. A lot of the hormones, testosterone, estrogen, some of the lesser hormones like pregnenolone will help with memory. They will help with focus and concentration. I do find a lot of patients that come in never had a history of ADD, and they get diagnosed later in life, and I tell them that's not true ADD because true ADD is has to be, you have to have it as a child, and 50% of children grow up to have ADD when they get older. So if you get it later in life, that's more likely related to hormone loss, testosterone, could be estrogen, could be thyroid, pregnenolone, versus it being an actual disease that of ADD. Again, some people come back and say, well, when I was around, they didn't diagnose ADD, so I could have been like that when I was young. And then fine, you were. But if it worsens, if you remember being somebody that had a little bit of focus issue, but all of a sudden you start having worse focusing issues up when you got into your older age, then it's more likely to be a hormonal loss issue.
Mental acuity, is it also related to dementia?
It can be. In fact, there's a continuum of dementia that there's out there. There's which is dementia meaning memory loss. Dementia is extreme memory loss. You can have memory loss, which most people would equate that to being normal as you get older. Occasionally forgetting where your keys are, forgetting names, occasionally recognizing faces, but not recognizing names or remembering their names. Math, some people have had issues with math in the past, what I've talked to. Then you go into dementia, which they consider one as senile dementia as you get older, which could be a little bit more extreme. There are also dementias related to blood vessel disease. They call that vascular dementia. So if you had little mini strokes or which you didn't pick up as a major stroke, can cause you to have some memory issues. And then there's Alzheimer's disease, which is a very extreme form. Can do a lot, can affect people's lives, not only the people that have the disease, but the loved ones around them. So.
Wow. So you mentioned testosterone, the hormones testosterone and estrogen.
Yes.
So if we replace those, we're going to be good?
There is a law of diminishing returns with hormone replacement. The only one that possibly has the potential to reverse Alzheimer's disease, and there's no studies currently in the works that show this. It's based on a study that was done on brain tissue cells that had the damage of Alzheimer's disease. So what they've shown is beta amyloid is what damages your nerve tissue in Alzheimer's disease. And they did a study with HGH, human growth hormone, and they did it in vitro, not in vivo, meaning they did it on the petri dishes with the cells, and they showed a reversal of the beta amyloid deposition, meaning it reversed the damaging component in Alzheimer's disease. Now, they haven't done any studies in people with Alzheimer's disease currently, so it shows the potential that maybe it's halt Alzheimer's disease progression and maybe even reverse it, but we don't know yet. There needs to be studies, large-scale studies done on people with Alzheimer's disease.
Exactly.
So HGH is the only one that may show the potential of reversing Alzheimer's dementia. In regards to testosterone and estrogen, again, in men, testosterone becomes estrogen, so it's more of the estrogen component that's been shown to reduce the risk for Alzheimer's disease. And the way it does it, it actually reduces the burden of damage to the blood vessels. And again, same idea, reduces deposition. The problem with estrogen, though, is if you look at the studies, you have to get people 10 years before the onset of of the Alzheimer's disease. And people, how do you know that? Well, the studies that were done were called retrospective studies, meaning studies that they went and looked back and saw when estrogen was started and when people developed Alzheimer's disease. And there's very good evidence that shows that estrogen, if it's been given or kept in optimal ranges prior, if more than 10 years before the onset of Alzheimer's disease, it's low risk that you'll get Alzheimer's disease.
Got it.
Now, if it's 10 years to 0 years, some help, but it's not as good as doing it more than 10 years. And then if it's have Alzheimer's disease, estrogen is completely useless at helping with people with Alzheimer's disease. So it's very important to be preventative with estrogen. And testosterone, more to help estrogen get where it needs to be. It actually forms estrogen. So in men, so you do have, that's how men kind of protect themselves against Alzheimer's disease. If you're looking at vascular dementias, senile dementia may fall under that because we don't really have a big etiology for senile dementia. It's, we just say it's dementia related to getting older. Well, what causes it? Well, it's likely to be just vascular, meaning you could have little mini strokes or little blood vessels could be damaged. Again, testosterone, estrogen, all the hormones that I work with reduce the burden of damage to blood vessels. A lot of it's based on cholesterol, a lot of it's based on keeping the inflammatory markers down. So that's how it can help with that.
Awesome. That's why I like Revita Medical, and everybody seems to fall in love with the practice that you have in Ballantyne and Uptown Charlotte, is because you actually get to know us and have us talk to you, and we can get to the bottom of the problem before it spurts out to an issue that we can't reverse.
Yeah, my biggest thing that I get a lot of people in regards to memory is, my father or my mom or my dad or somebody has Alzheimer's disease or their memory is getting worse. Most of the people that come in that have any memory issues, just what we call that minor memory issue, that they forget their keys or they're forgetting. They used to be good at remembering people's names. Now they have to write down everything they everything down basically. So that's easy to kind of work with. I do have a few patients with considered active Alzheimer's disease. Again, I tell them, there's nothing really I can do for them. None of the research shows it, but there's promise with using, like I said, human growth hormone and about possibly starting estrogen. It's better to try it with not do it. Again, if they're seeing benefits and the family's saying they're able to do their what they call ADLs, activities of daily living, meaning they can wash themselves, eat, cook, and stuff like that, then we're doing well. Okay. I have one patient that actually, she's on human growth hormone. They're not seeing worsening of the symptoms, but they're not seeing improvement. But she's not seeing worsening, so she's doing pretty good. Family's pretty happy, so we'll just keep it going, because my grandfather passed from Alzheimer's disease, so I know how devastating of a disease that is. And if you can halt it, heck, we can keep grandma or grandpa where we need to be. Let's do it. So.
Awesome. Well, I have so enjoyed this conversation. Concentration, focus, and memory. There is promise. There is promise.
Yes.
Dr. Peter Fatino's Revita Medical. RevitaMedical.com or 704-847-0011.